KFDX3 News, the spirit of Texoma. KFDX3 News at 10 starts now.
Plus, colon cancer is one of the leading causes of death in the U.S. That's why a little later in Medical Headlines, we'll talk to a local oncologist about the dangers of the disease. Welcome back, everyone. Tonight in Medical Headlines, we're talking about one of the 5 most common cancers in men and women, and it's colon cancer. It's also one of the leading causes of death in the entire United States. Each year, 50,000 people will die from the disease, but it can be prevented. And here to answer some of your questions about colon cancer is Dr. Praveen Reddy, who is an oncologist from the Texoma Cancer Center. Hello, Dr. Reddy.
Hi.
We sure appreciate you staying up late with us and coming in and chatting.
Thank you.
If you want to start out, how do you assess the risk for getting colon cancer?
See, about 1/3 of the newly diagnosed colorectal malignancies in US have familial clustering. The first-degree relatives of the newly diagnosed colon cancer patients are definitely at increased risk. On average, the population you can divide into average risk, increased risk, and high risk. If you have any kind of family history or a personal history or inflammatory bowel disease, you will be at average risk. On the other hand, you have a polyposis syndrome or what's called Lynch syndrome, you are at increased risk, and these patients were at average risk or high risk. They should start the colon screening a lot earlier. We cannot prevent this, but we can detect early, diagnose early, so the treatments can be much better.
And going on with those treatments, can you talk about some of those, and not only the treatments, but the prognosis of the cancer?
See, the treatments for the colon cancer has advanced so much in the last couple of decades. For example, if you diagnose a patient with a stage 1 disease, the 5-year survival is almost 90 to 100%. For a stage 1 and 2 disease, about 75%, and for a stage 3 disease, 50%. For those who are diagnosed with a stage 4 metastatic, either colon or rectal cancers, the 5-year survival is about 25%. So they should not be discouraged. They should try the treatments. Treatments are not that hard. 25% is a very good percentage to live up to 5 years.
Absolutely. So we're talking about it can be prevented. You said that folks beat it. People are beating it every day.
Yes,
so
yes.
What kind of advice would you give the folks out at home?
See, they should get the colonoscopy starting age of 50 years of age if they don't have any family histories. If there is a personal history, family history, they should be watching for constipation, diarrhea, or any kind of blood in the stools. They should be talking to their family doctors regularly. They should have a clean GI system. Their dietary habits should be good. No.
All right. Well, we sure appreciate you coming out.
Thank you, Gwen.
It's such an important topic that we let folks at home know about.
Yes,
Thank you
yes.
once again.
Thanks, Gwen.
And Tobin's in next. MSU was down to the wire tonight, but did they rear back with a victory? We'll be right back.